recently just started to call ourselves a campaign for mental health services in North Norfolk, simply because it doesn't feel like we've got any. You know, it really feels like that. There are lots of people doing a lot of good work, but in terms of the professional mental health services that we need in North Norfolk, where are they? About initiatives for young people regarding mental health and other issues in Sheringham. Excellent speakers there from people involved in schools, GP practice, etc. But so many people kept saying, there comes a point where you need the professional mental health services, and they are not there.
The campaign was started in 2012 mostly by staff who work for the Trust. But we were so outraged by what was happening. We started the campaign, and we called a meeting, I think it was in 2013 in Norwich, and 350 people just turned up. And that's where the campaign started. And it's been a battle ever since to try and improve mental health services. But what we're trying to focus on in North Norfolk is the concept of a walk-in psychiatric clinic, an NHS clinic. I used to work in one in Hammersmith, in the centre of London, where anybody could just walk in and see a psychiatrist, a social worker, and a psychiatric nurse. No referrals. They could just walk in off the street, and it was actually based in a porter cabin at Charing Cross Hospital in Hammersmith. And to me, it was a fantastic service. You know, anybody who'd missed an appointment could walk in and be seen. They might have to wait a bit, but they were seen immediately, and it was what we call an holistic approach. It wasn't just medication. You would get help from a social worker, advice, lots of things. And given the rate of suicide in North Norfolk, that's the kind of clinic I think we need.
My recent experiences have shown me that there are mental health services. They're just not there when they're needed. So I've dealt with 2 or 3 cases recently. One of them was just before Christmas, and it was a lady who was in crisis, needed crisis support, known that she was suffering with her mental health for many, many months before. She'd told the right people, she'd asked for help, and when it came to the time where she was almost about to take her life, she called the people that we would on call, and there was nothing. There was no help for her. Luckily, she called, the campaign office where we were campaigning, and we picked up the phone and we went out to see her. And after 4 hours of speaking to her, we suffered the same frustration of phoning the crisis team and getting the answering machine, phoning the surgeries for her and getting a "it's not our problem" approach. When we did get through to the crisis team, it was 48 hours before anybody would come out to a lady who was at risk of taking her own life. That's disgusting.
So genuine early intervention to me is a youth service. We had connections, and actually some of the gaps and some of the grassroots mental health work and the impact that they used to have. And when I was working, so I worked with young people, being able to work jointly with connections workers was amazing. They played a huge role, and obviously that is very much missed, and obviously they had a presence across North Norfolk as well, particularly at Paston College. I used to work really closely with the connections worker that worked in there. So bit by bit things have reduced, but also family support. The number of young people who find themselves in roles as young carers because their parents can't get support with their mental health or with domestic abuse and violence, all of those things, that has a big impact. The way that schools are, the narrowing of the curriculum, the loss of arts things, you know, if you don't fit into some of the academic subjects, some of the behaviour regimes in some of our schools, in my opinion, are psychologically harmful for children. That's what I mean about early intervention. We need to look further downstream and invest in there. I would have to agree strongly the actual number of pounds may have gone into the NHS, but for example in the youth team, referrals to that service almost doubled. So if the funding went up by a couple of %, but the referrals have increased by 48%, in real terms, that is a massive cut. So it's really disingenuous for people to talk about putting more money in and not actually being honest about what demand is on those services, because all that means is year on year that gap gets bigger and bigger. benefit system isn't fit for purpose. ESA, PIP, all of those things are not geared up for mental health. So in my role as a nurse, so much of the time the crisis I was dealing with was the degrading and inhumane way people have been treated, going through that system, just trying to evidence the impact that their mental health. And if you have a really severe mental health problem, the fact of having to go for an assessment in the first place, it's been a ridiculous situation where the evidence of me and a psychiatrist having worked with someone for 4 years was discounted with someone that spent 20 minutes in a room with a patient decided that they knew best. So people are treated in ways that harm their mental health. Housing, people are losing their tenancies. The supporting people budget was almost halved in Norfolk by the Conservative County Council. It was cut from 9 million to 4.5 million. What was that? That was actually tenancy support outreach for people with mental health problems and learning disabilities to help them manage their tenancy. If you get in debt, if you're at risk of losing your house, it isn't good for your mental health. That's what I mean by early intervention. So any service needs to have access to debt advice, welfare rights advice, really upstream to try and get people, stop people from getting in those really devastating situations in the first place. And all of the great stuff that people want to do in the community, that should be in addition to, not instead of a proper NHS service. I would also disagree that we shouldn't just accept that that need won't be met. Imagine if someone was standing up at a meeting going, okay, we've got loads of people out there with cancer, but we just need to accept most of that need's not going to be met. We wouldn't tolerate it. So I don't think we should lower our expectations or lower the bar at all in terms of mental health care. People need access to NHS care that is free at the point of use. They should be able to have it. As you said, people are actually having to pay privately even if they can't afford it. When I was working in early intervention, our waiting list was 2 weeks. We saw everyone in 2 weeks. Now referrals into the youth service, people are waiting a year for a triage appointment. They get a triage appointment and they may wait another 9 months to see somebody else. That's how downhill the service has gone since I started in 2003 in that youth team to now. So that is the very, very real impact of how the situation is. In order to put something right, I think we genuinely need to understand what is wrong and why, and I think we don't at the moment. There's been a failure of everything, of commissioners, of regulation. How can we have the Care Quality Commission, the regulator, saying there's a slight improvement, but in the report saying the very same things that was in the report in 2014? So I genuinely believe that we should be subject to a public inquiry, because at this level of death, Norfolk is an outlier, but it actually is appalling across both counties, and also people with the drug and alcohol service as well. We would not be tolerating that level of harm in any other service, so I really think there should be a public inquiry.
Thank you.
People have talked about putting mental health on parity with physical health and 12 billion going into the fund this year. Our question is we actually have to see that come to North Norfolk, and that's my job, to try and make sure that we do get that here in North Norfolk. I don't have a health background, I was in business, but many of the issues that you've talked about I've experienced firsthand. People that were working with me, young people, you talked about young people a lot this evening, young people that couldn't get appointments because they couldn't get bus service to Norwich to see a psychiatrist. Then they had to wait for an enormous amount of time. So, because I live here, grown up here, I can experience sometimes some of the things that you've talked about. I want to mention the Norfolk and Suffolk Foundation Trust. I have spoken to Jonathan Warren, I have spoken to a couple of the other staff there, and through behind the scenes the decision was taken that this should be a public meeting tonight without having them here, and then expand on that later. My take on that situation is it is a trust that has seen some serious problems. I think we all know that. The new management team there came in 6 months or so ago. They are in special measures. The latest report, I think, which was about the first week that I was elected, showed that there was an improvement. And I think let's leave it at that. It was an improvement. it's nowhere near good enough. It has to get better. The team that have come in, the chair and Jonathan Warren, from what I understand, have turned it around in other parts of the country. We have to allow, they've only been imposed 6 months, a period of time to see that that can start to work. And I know that they do have a lot of plans for Norfolk, particularly also for North Norfolk. And I know, I have said to him, you cannot hide away, you have to come and address the very deep issues that we have in this community. You have to come up here and you have to talk to people about the things that you want to address. So for instance, we talked about having clinicians in GP surgeries attached to them. That is something that they want to do. One of the big things that I am hearing a lot from everybody is having a walk-in mental health facility, particularly in Cromer. Now, we understand why that would be. I think Cromer is an excellent location, not least because it's in the centre of the constituency, not least because Cromer Hospital is absolutely fantastic, and not least because this community has seen some very, very sad things that have happened in the last few years. Now, I have already met with the Health Secretary, Matt Hancock. I have met with the Chief Executive of Norfolk and Norwich Union Hospital, and I have said to these people, we have a serious problem here. We have to get this right. We cannot start dithering with this. We have to address it now. And I said in my manifesto, I wanted to see a walk-in mental health facility in this community. Okay? Now, they're pretty bold statements, okay? But I actually think that is really, really achievable. And the reason why it's really achievable is what you can do. Cromer Hospital is fantastic, okay? There is space up there. We're already going to see a cancer unit break earth in March. It will be completed by next April 2021. But actually it's crying out for more facilities, okay? Now, more facilities for our older generations here. More diagnostic facilities so we can identify early health issues. And absolutely a mental health facility for outpatients. I'm not going to promise you beds, I can't do that. But I certainly can promise you that it is not beyond the wit to be able to get a facility there for mental health. And the way you do it is through an urgent treatment centre or a mini UTC. Okay? Now, cost-wise, I've already explored that. So we are talking probably under 5 million to do it. Okay? That is not unfeasible. So that's what we need to do. So my job is to work with the NNN, to go and see the Health Secretary and implore him to be putting money aside. The other groups, Norfolk and Suffolk Foundation Trust, to also put money aside for this. I'm new to this is not something I readily know about. But we need to put that there. And if we can get an outpatients walk-in centre in there, with psychiatric help, with social workers in there, that will be a huge step forward for many people.